Other Ashley's.
Maybe it was married.
Figured out why.
You good? Yes, we're good. Thank you. Very welcome.
It didn't take long.
Supposedly that camera was just activated. Supposedly.
That's true. On that with the phone, still.
I think we're ready.
Okay, well, try calling this meeting to order.
Camera's working.
Camera's working. I'll just go to the staff first and then next meeting.
Yeah, then.
Okay, go ahead. What we'll do is we'll jump ahead to introductions of the new staff.
All right. Who wants to go first? Bailey?
Screen.
So I think it's a great idea that our board meets all of our staff so you guys know what and what and where. So Bailey's not technically new anymore. I would say this month actually marks like 1 year anniversary, but she just hasn't made it down here yet. But this is Bailey Engelstad. She's been here a year. She's in our Children and Family Service unit, primarily doing ongoing child protection, but she has been digging into a little bit more like investigations and things like that.
You might as well. People don't know him, I'm sure.
Yeah. Okay. Bailey, anything that you want to say? All right. Then next we have Rich Green. Rich Green isn't really new either. He's been in the Children and Family Services unit for several years already. He was a youth justice worker. However, since I was promoted, Rich was also promoted. He is the new supervisor of Children and Family Services. So I guess he is new to that role. So he is here today to be introduced as the new supervisor. Anything you want to say, Rich?
I have nothing.
All right.
We're so gifted.
Then we have Tracy and Sabrina. They are both in our CCS unit. Nothing?
Sabrina, service facilitator, and I started in September of last year.
And I'm Tracy Forsyth. I started in March, the end of March this year. Yes.
Very happy that everyone's here and they're knocking out of the park with everything. That's very cool.
So far, we're hearing good things about all the new ones. The staff, I don't know about. The workers, good reports.
You guys have any questions for any of them? No? You guys can take off. Thank you very much.
You can
for
go up
stopping
mall
down.
and have a deep sigh and go back.
I can have a donut or some coffee if you would like to.
You guys
Sure.
I have.
Okay.
Thank you. All right.
Oh, we asked for public comment and they don't want to talk, so I guess we'll go past that one. Approval of the minutes.
Do we have to let her in?
Motion to approve the minutes.
Okay.
Any discussion on any of them? All in favor, say aye. Aye. Opposed? Carried. Jump wherever you want to.
Chris, do you want to go first so you don't have to sit here while we go through the vouchers and? Okay, so Chris is here to talk about our DHS 34 audit that was done in 2024. So we're going to skip ahead a little bit so Chris can present on the results of that audit when the state came in. Over there, whatever.
We'll just sit here. So, actually, I think it was great timing to introduce service facilitators for our CCS program, because that program is really instrumental in the results that we have for our 34 audit. So we have actually 3 programs that are audited by state surveyors to assure that we're following regulation. They come in, they spend a day with us, they read records, and it's a collaborative approach of trying to just assure that again we're following the guidelines, but There's a lot of recommendations that they can do. Obviously, there's citations that they can give if there's non-compliance found. So the CCS audit is coming due in June. And as you guys are probably aware, that Rusk County is part of a 9-county consortium. And I wanted to bring that up because there was so much talk about our CCS program in our county that directly related to our good results in our 34 audit. It is absolutely an instrumental program that is a proactive approach that keeps our crisis numbers down. So when you guys are seeing numbers in our board reports or authorizing another position for a service facilitator in the CCS program, just know that that is our upfront means for proactive measures in getting our consumers in our county assistance with mental health, drugs and alcohol type of things. So it's a wellness and recovery program. The 4 service facilitators that we have are, like Ashley said, knocking it out of the park. So our CCS population ranges between 40 to 80 people. And again, we have 4 individuals that are case managing that entire program. So that audit will be coming due in June. It's a consortium effort. So every county, even though we act independently, we operate under our area administration out of Chippewa Falls. So stay tuned for the results on that. Again, wanted to bring that up because when we had our 34 audit, which the 34 is actually our emergency mental health crisis response. That happened a month ago. We just got our statement of deficiency last week, so I'm reviewing that. The state surveyor that was here directly related our success in our 34 to Rusk County's proactive measures and approaches to wellness and recovery. When I started in this position, we had 4 people enrolled in the CCS program. And again, we're up to that fluctuation of numbers, like right between that 50 and 80 mark. And you could directly see our crisis numbers coming down as our CCS numbers were going up. So you always want to look at, you know, are we missing a population? Why are our crisis numbers going down? Are we not responding as much as we should be, or we have in the past? You know, what's going on? You're looking for all of those loopholes where we might be missing something. But when you look at all of the work that's happening, whether it's children and family, adult services, CLTS, CCS, all of these programs and in wrapping our members up in it are bringing those crisis numbers down. And a state surveyor from Madison was able to recognize that just from our paperwork. The linkage, the response, the follow through, she said it was top notch. It was one of the best surveys that she's ever been part of. So lots of great comments came out of that survey. We had a couple little technical paperwork things that we have to correct, and I'll be doing that as part of our plan of correction. The biggest thing that we're seeing, and I was talking to both Burnett and Price County and Washburn County yesterday. Every county in our region has been getting citations on variance waivers. And we saw that both in our CSP audit last fall and in our 34 audit. We got citations for both of them. And the way I'm understanding this is that the language of the statutory requirements have not changed, but the level of the individual has changed at the state, and his interpretations of that regulation has changed. So the guidance to the surveyors that are on the boots or on the ground, boots running, are citing for all of these variances that aren't done correctly according to what the new interpretation is. So basically it is saying that you know, there's a crisis, there's a shortage of psychiatrists. The language was written that a psychiatrist oversees all of these programs. They sign off on all of the programs. It's their credentials. And so these waivers are basically written in the fact that, hey, we have APNPs that are operating in these roles. We have licensed therapists that are operating in these roles. And the waiver gives us the ability to utilize those staff members rather than having a psychiatrist. There's just absolutely no way we have availability to those services in our area, and frankly, we couldn't afford it. So we are working kind of in a regional level. I reached out again to the surrounding counties this morning, and we're kind of working together to mirror our waivers and our variances to make sure that because we all use the same people. And that way we kind of have a systemic approach to all of our programs. So those are the biggest things that we're taking out of our audits that have come up. Like I say, there's been just a couple technical paperwork things that we're going to update. But the audits themselves are a true testament to what the frontline staff is doing, the dedication that they have. I know for you guys, again, you look at numbers on a sheet of paper, but you really don't see the upfront work that's happening to keep those numbers and our budgets, as much as you might think sometimes our budgets are out of whack. You know, it's really a true testament to the frontline work that's going on to keep those numbers in check. So
Do you want to specifically say what we needed to fix, correct?
Sure. Well, we had a client's rights specialist. So our first citation was right in that limbo of Jeremy leaving and Patrick stepping up. Unfortunately, survey happened right in that that lull, if you will, when Jeremy was gone and Ashley wasn't quite in that position. So the 34 requirements indicate that you have to have certified, trained clients' rights specialists. So you as a consumer, if you have a grievance, you have to have a pathway to be able to express that. Jeremy was our clients' rights specialist. His name is on all of our paperwork. Ashley had not been in the position, did not take the training, and her name was not on her paperwork, but Jeremy was no longer employed. So that has already been corrected. Ashley has done that training, and we will submit that as part of our plan of correction, get all of her name in replacement to Jeremy. So that was one citation. The other citation was actually an HR citation. Not that HR did anything wrong. When you're bringing staff on board, there's two pathways to a training, and it really is determined by your experience. So for example, if you're a new grad who has never worked in any role in health and human services, your training requirements are up to like 60 hours. If you're Bailey coming from another county who had all of this experience, her training requirements are 40 hours. So the state is saying, like, when you're bringing these people on board, how do you measure their experience? How do you measure their training? How do you measure all of this? So basically what I did is I went right to the state requirements. I put all of the statutory language in a cover sheet, and that will be shared with Ashley Goodis when people are brought on board. And so that checklist will be nice and neat in a little cover sheet, and we don't have to like thumb through all of these records to figure out why did we choose this pathway for training versus this pathway for training. So that has already been corrected. And then again, the third recommendation was the waivers. So I'm working on that right now. I really needed to see the statement of deficiency to understand exactly how to word that waiver, and I just received that, so I'll be completing that and submitting it. I did get notification from the state last night. We were texting or emailing back and forth that our CSP audit that initiated the first waiver was just accepted last night. So Ashley, you don't even know about that yet. But that was accepted. We'll be getting the final paperwork on that. I'll be sharing that with surrounding counties because we use the same provider. Yeah, and then stay tuned for the CCS audit. So that'll be in June. So it's the season, planting season. Do the fields and plant the crops and you're good for the year. So anyways, so yeah, regulatory compliance, staffing, training, program success, numbers low.
Yeah, I did get carbon copied that letter, and it's good to see that we get praise from someplace south of 29 or 54 or something. And it was, which we all know, we have a really good department, we're really effective. Not to say we're better than other ones, but I'm sure we're better in some place. And
The gal that did our audit, she was actually head of DQA in Madison. And so she worked in that role for many years. And she said she's planning her retirement. So she's recently stepped down as the supervisor for the state and put herself back on caseload as a transition retire. So she's never really been in this area. And these compliments were, like Phil said, coming from a supervisor at a Madison level, saying, the way you do internal mobile crisis is phenomenal. Most counties wouldn't even consider doing that. But the effectiveness of it, as she says, it's right here. So kudos to us on having the program that we do. Because it's noticed. And, I know we've said it before, Jeremy's probably said it, we're talked about at a state level of how our crisis team works in-house. So, yeah, so it was great. It was great feedback. It was great meeting Janelle. She did a phenomenal job, and the feedback was just, it was great. So.
questions?
Congratulations.
Thank you. Thank you. I can't take any credit, so thank you to all of these fine people.
I'm sure that they all find the letter, so they all know they're part of something that got praise.
They do, yeah, yes. And I think the other thing that they mentioned, and again, I think I tagged you in that original email, Phil. I wanted everybody to be aware, law enforcement. The communication and the collaborative effort that our county has and that upfront approach with law enforcement, they said is unheard of. That our working relationship really solidifies how that assessment is going to go. And so again, kudos to the chief and the sheriff and their team, because we couldn't do it without them. So there's a lot of players and a lot of components and a lot of collaboration. The hospital, I tagged, Courtney Meyer is the ER coordinator out there. Again, it's a team effort. We can't do it without each other, and everybody gets the praise. Just because we're the entity that gets audited, they're looking at all of those elements and making sure that all of those boxes are checked, and they are. And we sit in our behavioral health meeting, and that's what we talk about. All of those players are at that table. Sometimes we disagree on the outcome, but we agree to disagree, but we're making sure that we're doing things for the best outcome of our consumers. So, but that's where the hard work happens, is sitting around those tables and talking about how we can improve our efforts, what went right, what went wrong. that's what makes us thrive, I think, so. That Adam.
You know, there's always, we read in the paper, the county board minutes and all of those kinds of things. But, you know, this type of thing hardly ever gets out there to the community. There's some way to share this information with the community. So that, you know, there's a sense of collaboration, but a sense of pride also from the community and knowing that their taxpayer dollars are working and that they're being acknowledged by the state as well too. Maybe the letter could be shared. I don't know. But some kind of communication with the community that this is happening. I think would be.
Probably get somebody from the paper to, and
Yeah, they've done it
Interview.
before, but this is kind of a special deal. So I mean, it'd be good to get that out there.
Publicly acknowledge what we've known all along.
Reach out to,
Yeah.
she's been here, Jeremy and I, about some of these things.
Yeah. Or the one from the news who's been here several times.
Yeah, I can absolutely do that. To share the good things.
We do have the platforms. Yeah. Something a little less formal, but
Thank you, Chris.
Thank you, everybody.
Thank you.
Yo,
Deborah, one more time, Rich, before you leave, do the.
Sure.
Care grant. Sorry, we're all over the place today. This one is actually just really quick. It's in the packet. We just need approval to apply for a grant. It's called Act 260, foster parent grant. We just got notice that we could apply for it. You can apply for up to $15,000. We haven't decided on a number yet. Rich and Cheyenne, our foster care coordinator, gonna get together and come up with a more concrete number that we are gonna ask for. But we do need approval before we apply for the grant. So that's why we're here today, is just to ask for your permission to apply for this grant. On here, it says that, you know, the funds are used to support foster parents and relative caregivers, so all of our kinship families can get some support. And those funds can also be used for normalcy expenses, for the kids that are in care. You know, sometimes kids cost money, right? We all have kids and grandkids, and kids cost money. And this grant is out there to help these caregivers provide extra support for these kids that they're caring for.
When you're talking about support, are you talking about like social work support, staff time? Are you talking about purchasing of goods?
So examples that they've used were paying for some caregivers, so or paying for somebody like respite while caregivers can go have like a date night, you know, so they get a break. There's other things like maybe your grandkid wants to take dance lessons, but you know, it's really expensive, or guitar lessons. So these things, or driver's ed, those types of activities that support those caregiving activities. So, I mean, we really can be flexible for what that family needs.
Is this a one-time grant or is it gonna be something that be continued?
We can apply for it if it's offered again. I know that we did in 2022 apply for it. We got $6,000. I don't think we did it last year. But we do have a lot of kinship families that we're supporting right now. Our out-of-home care for like foster care is relatively low. But altogether, there are a lot of kids that, you know, we're helping support as a county. So this will be good funds. If it's available next year, we'll absolutely apply for it again, because it is beneficial for the families.
so foster care families up again, or open for more?
I think we're currently working on licensing 3 new homes for the county, which is a big number for us. Ones like this can help like prop that up a little bit. So licensing is a pretty big undertaking. Cheyenne's working really hard.
More good news.
I'll make a motion to approve.
There's a second. I'll second. figures it out. Any more discussion? All in favor, say aye.
Aye.
Opposed, carried.
Thank you, Rich. Go back to the beginning.
Right here.
Going all over the place.
I will apologize. Basically, I am supposed to ask the committee if they have any problems moving things around on the agenda. So you have the right to protest if I move stuff without asking you. I think that's just an unnecessary step.
Fine with, you guys want to proceed without accounting travel in our vouchers, or if you want to take Kaylee first?
I'm not in a rush. I can work on my emails and stuff. So if you guys want to keep it, in
Okay.
order, I'm fine.
All right, thank you, Kaylee. Okay, so then we'll go back up to the top here. Out of county travel. So for May, we have ADRC traveling to Eau Claire to catch the bus for Advocacy Day. Janice and Carla from Child Support, they're going to the Western Region Roundtable in Menominee. Tammy is currently at a conference right now, so our Veteran Service Officer is on here. And then we have our public health staff that are going to meetings, and we have a water sample drop off in Oakland. So that's what's on our out of county travel.
I'm sure the ADRC, that's a bunch of ADRC
I think there's
units,
three people.
besides us.
I don't know. Are
Oh,
you
because I
guys
know
going?
one time I heard something about that.
Right, Mark, you guys catch
Trying to
the bus in
organize a bus,
Madison,
so.
and then
There, I think what I saw was that there were 10 people at one time, but I think one person backed out, so I think it's 9.
Yeah.
okay. These are just staff members and the rest of
These are just our.
the community members. Okay.
Eau Claire, I think, is reserved to the bus.
I'll go to invoices. I'll try to make it. But just, as a side note, last month, I know there was a question on credits that we got from Cisco, so just wanted to answer that. I did talk to Kathy about that. She says that we get credit for, things go on sale. It's more like a rebate. And then if we ordered something and they didn't have it, but already charged us, that obviously we'll get a refund. So that's what she said for that. All right, starting on page 1, we have the Abbott Laboratories. Those are these insured cases that we order and we have for purchase up at Human Services. Access, that is for Aurora, utilizing our jail education groups and CSP services. Down below, there's several charges for Amazon. Again, that's kind of our norm for children's long-term support, therapeutic supplies. There's one on there for my new desk, just in case anybody's asking. The county was out of desks, so I had to order one. Maintenance said there were no more desks. So that's what that is for. Keep going with Amazon charges for therapeutic supplies. Those are all still CLTS charges, children's long-term support. So we'll go to page 2. The 4th charge down is an Amazon charge. It says 100-piece Green Mylar holographic bags. Talked with Kaylee. There's, I think, 2 charges on this page for those bags. They were bought for tick kits, and they were also handed out at the government day.
Yeah, we did like a little mental health thing for all the high school kids. It had information about like how to do box breathing or like different strategies for when you're feeling overwhelmed. There was like a little, just kind of some little resources for like a little, for a CHIP objective.
So that was what those bags were for. Then we have some office supplies. We have some tape, a couple chairs that were purchased. More CLTS. More CLTS. We have lots of CLTS charges. Wipes, things like that. Supplies for the senior center. Mop and mop heads. This Brother Genuine drum unit. I had to talk to Kaylee because I wasn't quite sure what that was, but that was returned. So
That was printer, they ordered a drum instead of a toner. And so then we had to drop it off when I was in Rice Lake. I dropped off at the UPS store one day.
So that will show up, I'm sure, later. More supplies further down, mouse pad, things like that. There's a charge for a hotel that was utilized with a grant, targeted safety support funds. That is a children and family grant for child protection cases. Veteran lodging, that Tammy was helping a vet with hotel stay. We have Anchor Bay, that is our crisis oversight with Michelle Rail. You can see almost to the bottom there on page 2, kinship and foster care payments. Several of those radon kits, that was public health. And we have them available to sell to people who want to test their homes. All right, moving on to page 3. We have CISA 10, that's our birth to 3. Chris Mark Home, those are adult placements. Again, trying to pick out some, go through everything so we move it. The community care resources, the fingerprint results for foster care. We had the contract with another agency to do fingerprinting for us. It's required for foster care licensing, and we have a kiddo placed a couple hours away in another county. And so we are working on that license, but it was easier for them to go to that facility to get fingerprints to get sent into DOJ. So that is what that is for. Dixon Company, the thermistor sensor. That is the thermometer that monitors the vaccine refrigerator. Family Farms, that is food for the center. Forensic fluids, those are the drug screens, the mouth swabs that Children and Family Services use when drug test clients where there's substance abuse or alcohol concerns. That's what those are. Yep, more subsidized guardianships, kinship care, foster care payments. Costner, those are the child support attorney fees. Lady Smith Hardware. That is, again, public health, sending to State Lab of Hygiene. Lad Lake, that should be the last big bill for Lad Lake because he is now with a relative. So 23,000 a month. There anymore?
Is that working out pretty good now?
It is right now.
Relative.
Yep, it is. Wow.
Good.
Yeah. Fingers crossed, everybody. All right. Go to page 4. Lady Smith News, printing the source. Sarah Siegler, our birth to 3. The McKesson Medical Surgical case of Visby sexual health tests. Checked in with Kaylee about that. There's special swabs that are used for STI testing, and we do get reimbursed from Medicaid for that testing. Couple more kinship care payments. Let's go down a little bit further. Rosa, our interpreter. And then we have several staff works charges again. You know, those are personal cares. There's going into homes. Stericycle. You know, the safe needle disposal. Questions on that page? All right, we'll go to page 5. We have Sunlight Assisted Living. Again, those are adult service placements. No changes in those. That is likely going to be a little bit yet that those individuals are there. Survey Monkey, that was broken down through 3 programs in public health. They have to send those out to gather data for some of their programs. Disco is more food for the center. Tomorrow's Children, that is still a youth that is placed. That is likely going to change. They're working on a discharge plan for June, and hopefully that stays on track and he is able to be discharged.
Where is he going?
He is going to be going with a sibling.
Go.
Adult sibling. Yep. So that'll be best case scenario for him if that works. So the Verizon charges, those are for all of the work cell phones that everybody has throughout the department. Walmart, there's more food for the center. There was a phone card that was purchased to help one of the children and family clients. Everything else is kind of the same old Department of Administration, economic support and child support. They're at work that they use. Any questions on page 5? And page 6, there's only a couple items on there. First 2 are background checks that were run through Children and Family, through our foster care coordinator. So anytime that we place or have to relicense into providers or foster parents, like we have to run background checks. So those charges, the overpayment for CLTS client, that was a returned item according to Brittany Magnuson, and then the Valley Lessons is for a kiddo that's in the CLTS program.
Congratulations, that's the fastest we've ever moved through.
I was like, I'm trying to get through it because I know everybody has things to do.
Question.
Yeah.
What about this plan of knowing where we are quarterly, less than that or whatever? Do we ever see that?
The budget. Yeah, I have some of them. We'll go over them later.
Thank you.
Yeah.
Motion to vouchers and out of county.
So move.
Second,
Second.
discussion. All in favor, say aye.
Aye.
Opposed? Carried.
Next up, I have just vacant position review. We're not doing too bad, actually. We have 2 openings right now, social service worker in the children and family unit. However, we did do interviews on Monday and there was a candidate that was very great and will be offered that position. I haven't heard if that individual has accepted or not. So if that individual accepts, then that unit will be fully staffed. Which will be awesome. The breastfeeding peer counselor interviews are on Monday. So hopefully that it will be chosen out of that pool. That's all. Otherwise, I think everybody's pretty fully staffed, which is awesome.
Meeting on committees meets Monday for our number.
Okay, so we are doing staff introductions. Request to fill position forms. So I have brought a request to fill vacancy form. So for those that don't know, Fawn Armstrong in our Aging and Disability Resource Center, our elder benefit specialist has resigned. She's given notice. She is going to Barron County. Her last day is, I think it's the end of the month, May 21st or something. So I have a request to fill that position since she is leaving. That is in your packet, I believe. Okay, so that is my request, that we fill that position, and I do think that it's a very important position. In talking with Fawn, I just really wanted to know all of the nitty gritty of her of her job, but she really, since 1/1 has already had 240 appointments. That includes phone calls, walk-ins, and scheduled appointments. So she averages 6 to 7 appointments every day, 10 to 15 calls daily. And she really does assist people with multiple programs and things. So I do think it's valuable to fill that position. So my request is this committee approve us going to personnel with that this afternoon.
I make a motion to fill in.
For a second,
I'll second.
any more discussion?
It's just one thing, I guess, is there some way of taking this to personnel at some point? Because she's getting $8 more an hour going to Barron County, doing the same job.
Very much.
I mean, that's a lot of money difference. And we're gonna be a training ground if we don't increase the salary. And she was a very good employee.
Yeah, she does a lot.
Yeah.
Actually.
Non-board members, would you like to see the paperwork that Kelly's talking about for filling this one position? You got all the rest of it there.
I think she had a
Oh,
copy.
yeah, I put it all in the packet.
Oh, did you?
Yeah, everything's in the packet.
I got 2 pages go.
Yeah.
Yeah, and the job description, everything that I have to take to print it out. So it was all in there.
Yeah.
Cause, I'm scheduled to present this at 3 then today at personnel.
Request. You're Begging more than Jeremy.
Yeah. Oh, yeah, my next request, this is what makes me sad, Ted. So Ted is leaving us to a new adventure. So my request is to advertise for another HHS committee citizen member. Permission to.
Motion
I'll make that motion.
or second?
Second.
Discussion.
Can you talk about your new adventure?
Sure. It kind of came up unexpectedly. My wife and I set a 5-year plan to move off the lake before someone moved us off the lake, such as my son or age or something like that. And so we thought that within 5 years, and we set that goal when we turned 70, within 5 years that we still had enough energy in us to start a new adventure someplace. So we started looking at homes in the Chippewa Valley as well as the Rice Lake area. And so, this is 3rd year of the 5-year plan. And we ruled out the Chippewa Valley area simply because by moving there, we'd be starting all over. We came from that area originally, but we've been 20 years at the lake, so things change in 20 years, and so it would have been starting over. So we focused on the Rice Lake area, thinking that there'd be another 2 years because there's just not a lot of opportunity in Rice Lake. And we looked at a home. This was the week of Easter. We looked at a home north of Rice Lake that didn't turn out, and our drive back into Rice Lake, we drove into this area because we knew there was some property for sale. And we drove around the area, and there was this little card, garage sale sign out in front of the driveway. So we pulled into the driveway and said, "You having a garage sale or is your house for sale?" Said the house is for sale. About an hour and a half later, we made an offer.
That.
Impulsive. Huh?
Not impulsive, no. Didn't have to discuss it, check the boxes for us. And we said, if we don't do this now, we're not going to do it. And that was the other thing we said. If we saw a house that we liked, we were going to move on it. If we weren't going to move on it, then we weren't going to do anything. So we did. So it is just outside of Rice Lake, about a mile outside of Rice Lake on 2 acres of land. It's so I will be sad to go. I mean, this has been a good experience for me. So thank you.
It's only a couple more miles than what you're driving now.
That's true. I relate to Rice Lake a lot, and so I go to Rice Lake probably 3, maybe 4 times a week. And so for that drive, it's probably 35, 40 miles. This will cut down miles, and it'll be good. It's a great adventure. It's time to do that. So no regrets.
What lake are you on now that you're leaving?
We're on the Island Lake chain, so we're on McCann Lake. And we sold our house. We put it for sale. It sold in 2 days. So things have been moving quickly.
They've always had great comments, so we'll miss you.
Yeah, miss you guys too. Thank you.
Good luck. Appreciate all your service. If you decide to do the same thing over there, I'm sure you'd get a couple of letters.
I don't know. I don't know if they have community members over there. I have to check that out.
Write a letter recommending.
They probably do. So I'll probably get in touch with them. They could use a little help over in Barron County.
That's great.
Besides all the staff they're taking.
That's right. That's right. Yeah. Yeah. We'll try to send them your way.
That'll strain them and then you use them.
Okay. Don't blame me.
All right.
We have to vote on that.
That's what was my next question. Any other discussion or thanks? All in favor, so say aye.
Aye.
Opposed, carried.
Haley?
All right.
Yeah, you're up. Woo. So I asked Haley to come to talk today, just after the Greenwood Manor fire. Health and Human Services and Public Health had a lot of time invested. And I just feel like it's important that everybody here be aware of everything that this department has done. So that's what Haley is.
Yeah. Before I start, Ted, I do want to say thank you. I remember when I was a new health officer and we had our CHA kickoff meeting and you joined and I was just like, oh, someone from the board actually came. And it really meant a lot to me. That's like being brand new and not sure. And they do have community members in Barron County. So if I'll put a good word in for Carla there. I'll be there for you. If you want to join.
Thank you.
Yeah, so the shelter. Okay, so I got a call from Ashley about 10 o'clock Tuesday night, which I think was about an hour and a half after the fire started. One of the things I realized is nobody realizes that public health is like trying to open a shelter and that we have a lot of like work we do in that. So if Ashley wouldn't have called, I don't think anyone would have called me. We would have just found out afterwards. But Mark was there. Red Cross came on scene, Mark and another Red Cross worker. They were thinking it was just going to be like a couple of people displaced. And
What we were told.
they got
I
there.
to the corner and I saw the trucks.
Yeah. So then they just went on the fly. Red Cross came up that night from the regional office, brought the cots. We got the rec center set up. And we had 19 people that stayed there 18 that stayed there the first night. And then the next day, about some of them found, family and friends to stay with, made arrangements. We were down to 8. Then Wednesday we had 9. Thursday and Friday we had 9. We finally closed up on Friday. But so just kind of going over what all, because Red Cross was the ones running the shelter, but we definitely were heavily involved. The first night, Mark and I and Kevin from the police department were setting up cots and doors from the shelter or from Red Cross. So
Those cots are fun to put together.
they're hard. If you never put those together, those are really a pain. Yeah, it takes a lot of muscle to get those together and all up and sturdy. But otherwise, public health, Talia, our preparedness nurse, and I were there every day, pretty much from before breakfast to after dinner. And then somebody from Health and Human Services came like from dinner time until bedtime. And then Red Cross was there by themselves overnight. But just so you guys understand, like some of the stuff we did. So Talia and I were there, we were coordinating supplies, we were making the phone calls. We had 6 cats there. So we were coordinating, like getting crates from the animal shelters. We had dog crates with litter boxes and bedding for the cats because you can't have cats running loose. But they do, like the policy with Red Cross is kind of it's best to keep pets with their people if at all possible. So, and the cats were all pretty well behaved. So that was good. We were coordinating with like Lighthouse, like the Russ County Housing Authority, Bruce Housing Authority, just trying to see who had openings, where we could get people placed. We were picking up food and running to Walmart and getting supplies, and then trying to kind of keep social media up to date. Like at one point, we put out a call for like pillows, because Red Cross brings the cots, they bring the blankets, but there's not pillows. So people were like rolling up sweatshirts or whatever. And the community like bombarded us with pillows. Like after 45 minutes, we had to be like, okay, no more pillows. We have plenty, which is a great problem to have. But I think we got like 4 or 5 dozen pillows in like no time. So also the people that were from the shelter, Greenwood Manor is a lot of older adults. It's low income housing. A lot of them had health problems that needed like actual nursing care. So we were down there doing nursing care, emptying ostomy bags, doing dressing changes, helping people to the bathroom, just way more hands-on than you would think for a shelter. And like Red Cross, well, our training is always that they need to be appropriate for a shelter to stay at a shelter. And like some of them had mobility issues. There was a person in a motorized wheelchair. There were several that used walkers. There was people that had a hard time getting in and out of those cots. And it was like, took several people to get them up and moving in the morning and get them in the cot at night. So I tell you, they have to be appropriate, but I guess we've never talked about what do you do if they're not appropriate and you say, you know what, I think you need to maybe go to the hospital until we figure out placement or something, and they refuse. So like, you can't really lock them out of the shelter, you know, you're not going to like leave them. So you're trying to do the best you can with them. But it was a lot of cares. Like some of them had personal care workers that would come for a couple hours in the morning and help get them like dressed and ready for the day. But then they were on their own the rest of the day. So that was definitely more time intensive than like you think about when you're going through all the shelter planning and what you're going to need to do. But then also just touching on what like some of the other departments, like ADRC supplied us like with adult incontinence products. We had tons of briefs and things. They provided us with like the pads. The senior center cooked lunch every day, like Tuesday, Wednesday, and Thursday for the people at the shelter and for the volunteers. And then they came to the MARC, which is the multi-agency resource center. That was on Friday. And then it was kind of providing everyone that was involved in Greenwood Manor, like all the residents came to the MARC and had a chance to like sign up for, to get like their benefits from the Red Cross. Mark was there again for that. Salvation Army was there. Some housing groups were there. Like a lot of Health and Human Services groups were there, like ADRC, to see if they needed, well, like Ashley and I had to go get a commode for somebody that like had lost their commode. And so we had to go to the supply closet and get one Friday afternoon. Just kind of, you know, so that's some of the stuff ADRC did. They were great about whatever they could help with. They brought risers for the bathroom. So we had toilet risers on 2 of the toilets because there's such mobility issues. And then like the veterans, Tammy worked and got her veterans placed in temporary housing at least, so they could get out of the shelter and stay at a motel. She also brought in a recliner for one of the people that had a hard time getting in and out of the cot and slept in a recliner at home, so they could sleep in a recliner. And she brought a lift chair for the gentleman that was in the wheelchair, because getting him in and out of the cot was very hard. He actually, I don't even think he tried. He just would stay in his recliner, in his wheelchair, but that's really not good to be sitting in a wheelchair for long periods of time. That leads to skin breakdown and problems. So, so she was really active, not just with her veterans, but trying to help, like bringing things from home to help make it easier for the people. And then she came to the MARC to see if there's anyone else from Greenwood Manor that had been, involved in like services that she could coordinate with. Children and family brought in blankets. They came the first day and kind of interviewed everyone at the shelter to see like what services they were already linked up with, what kind of needs they had. And then economic support worked. There was a gentleman that got discharged to a nursing home. We had to change his insurance group because the one he had wasn't accepted by the nursing home. So somebody came from economic support, worked with him to get that set up so he could get accepted to this nursing home and get discharged there. They came to the MARC and helped like reissue food share benefits, see if anyone qualified for food share that wasn't already on it. And then adult services, I saved that for last because they were definitely the biggest lift. They came, so after, by Tuesday, we were down to like 8-9 people, and they just like they had a hard time making a plan. I mean, it's overwhelming. I'm sure they're in shock. Their houses, you know, they can't go back home. They're not sure what they're gonna do. Nobody has money saved for like a security deposit or to like, or even necessarily like make a plan and like, who can I call or where can I stay or what can I do? So Chris came in on Thursday, met with every single person that was left, talked with them about options, had like frank discussion, like what are your finances at? Like what, you know, trying to figure out where they could go, which ones needed higher levels of care. We ended up having 2 people that discharged to assisted living and one that went to a nursing home out of the 9 she met with. She coordinated with Inclusa and worked with them to get them out there and really work with their people. And then she was also at the market and meeting with people like they had more questions and things. So yeah, I think that, am I forgetting anything for Health and Human Services? I think that was, oh, and then Carla was out there volunteering the first night with Tammy. So, and also CCS came out a couple nights and volunteered, well, or worked the afternoon so that I could go home and sleep and eat. So yeah, I think every department was out there.
Yeah, it was all hands on deck. Everybody helped whenever they could. All the other agencies that were around, like they were awesome. St. Mary's donated clothes, the ER donated clothes, Connections donated clothes. One of the Red Cross workers delivered some cats to the kennel by Cadot because this woman had 2 cats that we couldn't find placement for, so she could leave. So we arranged for the placement of these cats in this kennel, and
Red Cedar brought, we had some
yeah,
meals,
Red Cedar
suppers.
got food from like
Dropzone
the family.
Dropzone.
Dropzone brought food.
I mean, the community was
Everybody was
amazing.
amazing.
This department was amazing.
Right, and
Everybody
even
was very helpful.
the people back here, Rhonda was coordinating, like she sent me a message like, hey, so-and-so said that they'll donate food. Who do I need to put them in contact with? And just,
yeah,
full logistics of all that.
So I had asked everybody that I knew had been out there, just so I kind of had an idea of how much time that our staff spent out there. And it was 173.75 hours in those couple of days. That was DHHS staff. And that's not including stuff that, you know, like Rhonda coordinating and taking phone calls. It's not reception, you know, transferring to the ADRC for benefits. It wasn't anything like that. That was just time spent at the shelter, not work that was done here in the building. So we spent a lot of time, and I think that obviously that it was kind of a learning curve. We could probably improve on some things just all together, not just us, but as a community. But overall, I think that we did a really good job.
Are there still
The hand.
play stuff? Or are they all?
There's some staying at Lighthouse. I mean, at the homeless shelter, at least they have a bed, they have a room. It's gonna be, part of the thing was the apartment complex wasn't sure how long they were gonna be closed, and all of us working there thought it was gonna be months probably, but they were very vague. And so I think a lot of the residents were kind of holding out hope, like, well, we can probably go back next week, or my apartment wasn't that damaged. And the fire went up through the, like all 3 floors through the HVAC system, and then there was smoke and water damage throughout. So finally Friday they came and said, well, it's probably gonna be like 6 months to a year. And they are offering, they can stay at another, one of their buildings if there's openings, but there's none in Rusk County. So like, can't even remember where AACs are. I want to say there's like one in Tomahawk. So like they could move to Tomahawk, renew, you know, pick their lease right up where it's at, keep their rent the same and everything. And then if their apartment gets ready, they could move back without having to like break a lease and all that kind of thing. But most people want to stay in Ladysmith. They were a very tight knit group. Like they all know each other. They were very, you know, spent a lot of time just in the community room, like in the cafeteria, visiting and talking. And a lot of them want to stay here. So. And we already don't have a ton of housing options, and especially that are like low income and, you know, within reach for people. So.
Kaylee, since that's a HUD apartment, does HUD continue to reimburse or somehow pay the provider who can help to find and reimburse housing on an ongoing basis while they're out of their current situation?
It didn't sound like it from what, but I'm not sure, like, because it didn't sound like they were, the apartment complex was kind of putting it back on the people, like that they should have renters insurance to cover staying somewhere else or everything.
Sure.
But
Since there's HUD reimbursement.
There was one person that had.
There was a couple,
Nobody
one,
at the shelter.
there was one
think-
one person, okay.
The last person I talked to from the Red Cross said, the one that was
Okay.
working 20 hours a week had parents.
It seemed to me when I was working with HUD that there was some kind of a, in the event of an emergency, that there would be some type of HUD reimbursement that would come through, because as it works, you know, they're paying what, 1/3
I
of
think
their
so.
income, something like that, relatively, but HUD is reimbursing the owner
Okay.
of
for
the building. So there's dollars, I mean, I don't know if that just stops, or if that individual continues to get those dollars, or if there could be some assistance, because those dollars are paying for assistance in housing.
Right.
So perhaps there's something there. I don't know for sure how that works.
This is why you can't.
I would suspect the owner.
The owner would know. The owner would know. HUD would know for sure, if you can find the right people to talk to.
I mean, the owners weren't super receptive. They did finally come out on Friday and talk to the people, but, and the apartment manager was actually, had put in her notice and was before this happened. So I think she's,
The owners have some responsibility. I know that for sure.
and I don't feel like they were really stepping up at all. I mean,
Well, HUD could help them step
Okay.
up.
I can look into that.
Yeah.
I think the staffer should have gotten kudos for all the work that they did.
Absolutely.
Well, and that's what I mean. I feel like, you know, Red Cross did a lot of work. You guys lot the shelter. Mark, I talked to you because you're the Red Cross guy, but, but I mean, it was a lot. I mean, a lot of like hands-on care for a couple of those people, and
I've been to a lot of places with shelters and stuff, and this one really went well. I mean, the staff here did a very good job, and you know, the city and the county actually worked well together. I mean, the city opened up their facility, and by the time the residents got there, they had pizzas and donuts and stuff from Quick Trip and water and things all set up before the Red Cross got involved.
yeah, they were, by the time I got the call at 10, somebody said that the rec center was being opened up, and I ran over there, and yeah, they were already ready to go. We had to get the cots and stuff, but I mean,
First time I've done all-nighters since college, I think.
Mark did 2 that week.
And I hope not to do it again.
Yes. So yeah, I just want to kind of give you guys a rundown of like what all HHS is doing there, because it was, like I said, all programs. You know, I don't know. I'd call Kay at EDRC and ask her if, you know, do you have any of this down in the closet, you know, supply closet? She's like, I think so, and she gathered it up, and it was great.
The newspaper did a good job on reporting what happened there.
Yeah, there was a couple things I was like, I don't think that was exactly how, but you know,
Typical though.
you know, that's
Pretty close.
it was nice that they covered it and went to the mark and stuff. So yeah.
But I think the small community really, you could see the community being involved with
Right.
it here, and
They
it was
were
really
great.
pretty impressive.
Like they were, you know, looking for ways to help and stuff.
How
So
did you put that out?
we shared it on Facebook, like when we needed pillows. And then like we had asked for like snacks and stuff because people are sitting around, they're just kind of eating donuts and stuff. So people brought snacks in, and like the city loaned us their Keurig coffee machine so you could brew a cup of coffee. And so people brought K-cups, and it was just, I mean, people brought jigsaw puzzles and crossword puzzle books and fruit and more blankets. It's just, I mean, it was really nice. So, yeah.
I got invited to the recap,
Yes, we did our after action kind of hot wash of it on Monday.
and it was really impressive because all I got was scanner head input, sitting at home listening to it. But I think actually everybody agreed to try and learn from this, because
Well,
my parting comments was everybody did good, but there is room for improvement. And we know some of them. One of them was, I was going to bring up, but the fire chief brought it up first. Last one of these type of things I sat on was, what happened is this was 20 below and 30-mile-an-hour wind. Changed the whole scenario on this. So you have to have that in your plan and be prepared for. And we have to have a master something or other of not people, but of departments and what they can do. You know, everybody should be able, the fire chief, the police chief, whoever is on the scene, fire chief even should be able to look at this and say, all right, these are some people I gotta call right now. You know, because there are so many people that learned about it in various ways. You know,
Yeah, because I had gotten a call and it was just because Cheyenne lives in town
yeah,
and had seen it because she's obviously related to Nate Tiffany. Nate's on council. And so she's the one who called me and she said, hey, I think we need to get involved. So that's when I called Kaylee. So otherwise, I don't know that I would have got a call either for a long.
Right. And I already sent out an email to like the police and sheriff's department, like, these are some of the things you might not realize public health does that you could loop us in on. I mean, and even things like dog bites, we follow up for rabies. And a lot of times I feel like we don't hear about those till way after the fact. So I just included like all the things that, you know, there's several things that there's just been so much turnover in all the departments. I think stuff just kind of, you know, that knowledge kind of just falls off.
so hopefully we can get better for something that's not gonna happen, but.
Right, yeah.
All right. So then you had just funding updates. Okay. So I don't even know where to start on this one. I put it in my report that the farmers market nutrition program is kind of on hold right now. We still think it's going to come through. I met with the farmers market people last night at their annual meeting. I wanted to just touch some of the things that are like kind of like up in the air right now for funding. So the farmers market nutrition program, actually I brought you guys, I'm a visual person, so it's easier for me if I have like something to look at. And there's stuff on the back. It's not really that one too.
Sure.
I'll give you one for records there. Oops, that's my copy work. I was that one. Okay, so the farmers market nutrition program is through WIC. So it's for women that recently had a baby or are breastfeeding, and for children that are under 5 that are on WIC. The last couple of years, they get $40 in farmers market nutrition checks. That's what these look like. They get like little paper checks actually issued. They're in $8 increments, 5 of them, and then they can go to local farmers markets and redeem those for local produce that's like Wisconsin grown. Fruits, veggies, and herbs. They're listed on the back if you're interested. Kayla was very thorough in giving me all the information. And then like the farmers market has their own program where they fundraise and they will match what they get from WIC and give them that in additional goods from the farmers market. Not just fruits, veggies, and herbs, but they'll also let them use them for like baked goods. So they could buy, you know, a loaf of bread, or they can buy a pie, or they can buy honey. And it's really taken off. WIC is really good about promoting that program. They're really trying to encourage their people to cook. They share seasonal recipes. They share, you know, how to cook asparagus. A lot of people might not realize, you know, how to cook something that as simple as that. So they go down to the farmers market. They will meet with their people, teach them how to cook local goods or local produce. And it's kind of the farmers market does their part. They have shopping carts there for moms if they want to, like, you know, put their kids in the cart and push them around. It's turned into more like a kind of like an outing or an event. Like, you know, you can take your kids to the market, you can see local produce, you can make kind of a little, you know, trip of it. And typically that funding is issued in June. It's on hold. Kayla's saying she's anticipating it's going to be July, but the dollar amount might be reduced, more than likely be reduced. So that's one thing. I mean, it's not really directly funding public health, but it's a benefit that people in the community get. And it also benefits the farmers market vendors because they get reimbursed when they cash their farmers market checks. That's money that goes in their pocket too. So last year, WIC families redeemed $4,832 at the market. So that was 51% of the checks that were issued, which is really pretty good because it's only the Ladysmith market and not everyone lives in Ladysmith. Not everyone can get to the market, but the ones that use it love it. And we're kind of bummed that it's going to be delayed. We're hoping July it'll be issued, and also this year they're expanding. The Bruce Market is going to be a part of it this year too. So they could go to the Bruce Market on Fridays and use their checks there. So I just wanted you guys to be aware. I'm like, you guys probably don't even know that this program exists and like how cool it is. And that's hard for me to be like, hey, so that's the funding's held up without giving you the background. So we're hopeful that one's coming through, probably at a reduced rate. But then I just wanted to kind of update you. There's a lot of funding stuff coming through for public health that is kind of concerning. We heard we're gonna probably lose half of our immunization contract that comes through the state. Okay, let me back up for a second. So a lot of public health funding comes from the state, but the state gets that money federally, and then it comes from the federal down to the state, and then they disperse it to the counties. So like the federal budget is impacting what we're gonna get at the local level probably. So like our immunization budget, we're probably gonna lose half of it, which is $2,300. I mean, it doesn't sound like a big, huge sum of money, but it's concerning to just have half of it cut. Immunizations are obviously like important, you know, we're going to them either way because it's a communicable disease thing. Our vaccines are all supplied from the Vaccines for Children program that's from the state at no cost to us. So it's just more like my staff time, training, like, you know, putting the vaccines in work. That's what comes out of the immunization budget. So that's probably happening for sure. There's also the COVID supplemental grant, which we are down to only $1,200 left in that. But we had gotten word that all that money was pulled for every county. And now there's like a lawsuit with the state putting like a, you know, arguing that it should be pulled. So that's kind of on hold. They're telling us we can spend that. But it might be pulled back, whatever we don't spend. So that's what we had bought the immunization refrigerator with last year, was out of that grant funding. And I think they're like, well, COVID's done, so we don't need to worry about this COVID grant. But then they were, you know, directing it more into like immunization programs. Like we're also using it when Rosa provides interpretation services. We can use that to pay for her costs. So we're not paying that out of tax levy. We can use that grant. So that's another thing. If that goes away, we're still gonna have to pay for an interpreter. We just won't be able to pay for it out of the grant. Some of the scarier ones. So the skinny budget came out on May 2nd, which is the president's like recommendations to the rest of Congress. So in there, they're proposing cutting preparedness for public health totally, which all the work Talia and I did last week or 2 weeks ago at the shelter was under the preparedness budget. Like when we go to training for shelter, that's under preparedness. That budget, we get about, let me see, 27,000 locally. And they're saying that the states can make the determination on how to spend that. But I feel like the state will probably want to keep that money in at the state level. I would anticipate we'd have a cut. And again, that's just the skinny budget. It's not come through anything yet, but it's just kind of concerning that it's on the, you know, that it's being considered. Also, maternal child health was on the skinny budget to be cut because they're saying it's a duplicate service of other HRSA projects. Our maternal child health budget is only about $7,400, but that's also money that public health uses for programming that is, you know, being considered for cuts. So I just want you guys to be aware, you know, that's, like I said, that's a skinny budget. It's just the recommendations. It's not being voted on or anything yet, but these are all things I'm anticipating there will be cuts coming for public health when the budget comes through. So yeah, I guess I just want you guys to be aware. If there's questions, if like I think since I'm in here, I feel like everyone knows what I do. Like, you know, everyone in the community knows that we do shelters and stuff. And then I'm like, oh, people do not realize that that's a public health thing. So if there's stuff you guys want more information on, if you guys want to talk about public health, you can always call me, come on up, we can meet, we can go through stuff. I think we do a lot of important stuff and I don't think we're good about publicizing it. So I would love to talk about it more if anyone ever wants to.
I think what you're talking about in those kinds of cuts should also be advertised somehow and made public. Otherwise, the public doesn't know. It becomes invisible. And if there's an impact, I think it should be, you know, you should say it the way it is. You know, this is what's happened. This is what the cuts mean.
There's a lot of variables. Like if they cut preparedness, then the states would probably still have to pay some of it. But how would they, and how would we be funded? And you know, we won't know that for a while. But like, I mean, I have staff that's a big chunk of what we pay their salary out of is, you know, doing preparedness, or a decent sized chunk. You know,
and you take those dollars and you multiply it by the number of counties in the state, and it becomes a lot bigger number.
Right.
25%, did you say?
37 county fringe, I think, or 34 county fringe. Yeah, and I mean, and even if like the states get funding, you know, and it's cut, the state's gonna probably want to keep preparedness there, but then they're not gonna come out here if we have a shelter. It's gonna be Mark and his Red Cross friends and maybe me because there won't be anyone else left. I don't know, but like, you know, it would definitely impact a situation like this. So, yeah, I just want you guys to be aware, I guess. Like like I said, there's a lot of variables. I'm hoping it kind of, you know, doesn't happen, but it's kind of scary. So just wanted you guys to know. So any other questions or? All right, I think that's all I got today. Bill, what's that? Boy. All right, thank you guys.
Thank you.
Thank you.
Okay, so the director's report section now on the agenda. So I know that it's been talked about, department head doing the budget report form. Maybe yes, no. So the concern that I have right now, being new to this role, and that the human services, we have 38 budget lines. I'm gonna tell you that I did not get them all done for today's meeting. And to be honest, Laura worked on these, and so I think I have 7 or 8. But we're supposed to go through and each budget line, and you guys are supposed to know where we're at. Right now, there are no concerns just because it is too early on in the year. We have a lot of that are like Medicaid reimbursed, and that stuff has not come through yet. So Laura has been very adamant that our budgets are never going to be accurate when I show you guys at these meetings, just because of the lag in our reimbursements and things like that. But I will go through the 7 or 8 that Laura does have done for this meeting, just so you guys are aware. But I was supposed to have all 38 done for today. Phil's supposed to sign them all. He's gonna get like purple tunnel for signing every single.
I want to stamp.
Here, so, so that's, you know, Lois brought it up, and I'll go through more on them. But right now there's no concerns just because of where we're at in the year and the reimbursement, but here's the one that we have done. So my understanding is then this has to go to finance for review. So they can keep tabs of where we're at. Where did?
That's your coffee.
Oh, I guess I need it then.
Yes.
My mind was telling me it's chocolate.
Yeah. So I apologize that I do not have all 38 done for you guys today. But
We're gonna talk about consolidating some of those things, or
so I'm just gonna be, I'm new card there on Lois. Cause I don't know enough about all of our different line items yet, just because I know like public health, like it is one like department, but there are so many different pots of money that are going into all of those, like WIC and preparedness and the maternal child health, like they all have their own lines. And the same thing with like ADRC, like Kathy's, like this is just the overall ADRC, but then there's different inside of that. Get more experience. I hope I have a better answer for you. So I'm really relying on Laura, like full transparency, like Laura knows our budget inside out, and she is a rock star. So I'm really relying on her. So she is the one who actually did these for us. But she right now, like I said, hasn't been reimbursed for everything yet. And you know, that lags a month or two, sometimes behind, depending on where that process is at. But right now, he is saying that our budget, hey, we don't have any concerns. Obviously, any placement in like adult services or children and family can really tip that scale like, at any point in time. Like our budget is pretty unpredictable because things change. So like anybody can have a crisis at any time and we're gonna have to place somebody, adult or a child.
So do you have to do these quarterly?
I'm supposed to do them every month. So I'm supposed to present to you guys every month, for all 38. However, when I was talking with Ashley, she said that once we get them going, I should just be able to present like areas of concern, bring like that versus all 38, because I mean, I know that you guys don't want to sit and listen to all 38 every month. I'm sure that I don't want to be presenting on all 38 of them every month.
The reason they did that was to keep everybody aware of
Correct.
where they are.
Yeah.
Instead of get to the end of the year and you're crying,
Well, I understand why. I absolutely understand why. We don't have just one line. We have 38 and it's just a lot of work to fill these out and update them every single month to have everybody. I have to sign them, Phil has to sign them, finance has to sign them. I think it's just a lot of steps that needs to happen, but I get why it was done. I'm not questioning that at all. I get why it was done and why it's
once
important.
they get going on this and they know, this is just the beginning, they can modify it.
Yep.
And
So right now, this is the ADRC that was completed. Like I said, there weren't any concerns noted yet. Other one. Children and Family Services. This is the Children and Family Services budget. Obviously, like I said, at any point in time that can change, any high cost placement, any residential placement. But obviously with our kiddo leaving Lad Lake is helpful, and with the youngster being discharged from Tomorrow's Children, I mean, that's gonna save our budget probably about 35,000 a month with those two just being out of those residential placements. But like I said, at any point in time, somebody could come today and we might have to place a teen or something, you know what I mean? Like, it's just, we can't predict these things. This is our Children and Family. Support here. And like I said, I do apologize. I did not have all 38 of these done. But we are working on them. Just know that I'm not ignoring it. It's just 38 is a lot to do, and have Laura doing her rest of the work and then myself, learning the new job and trying to do everything else. So I am working on it.
I give you the number. You don't have to add it up in the budget yourself.
So Laura has access to like our budget live from finance. So she's able to just pull it out of there and put it on here. Like I said, Laura has been awesome, and she really does have a pulse on everything. And I don't know what I would do if I didn't have her, just because there are so many different things and lots of money and reimbursements, and there's just a lot that goes into our budget, and I'm still learning all of that. So I just ask for some patience as I get through this. Immunization.
Well, in any of these budgets, I mean, you've got your projected, expenses and revenues and things like that. But you'd have to dig deeper to find out which pots of money haven't come through yet, or what the timing issue is on all of those. And
yeah, and I don't know the timing for the reimbursement, like any Medicaid funded stuff like that. There's a lag in that. We're not going to get reimbursement right away. So most of our budgets aren't going to be accurate. I mean, some of them will be fine. Like some of them aren't going to change. Some of them will change frequently with reimbursement. So their public health budget. As we get going here, some red flags might show up for concern areas, and I'll absolutely, keep you guys appraised of that. So reproductive health.
And sometimes if you do have a big thing, you split it maybe to different things too, so.
Yeah, which is what Kaylee does. She's really, really good about that. Because there's so many things in public health that kind of touch on this and this and this. So she will, she'll divide them up into the different funding sources. So, and then here's our WIC. Yeah, please don't think I'm ignoring it. I am working on them. And those are the ones that we have done right now. Really nice if we just had like one, that'd be cool, but we don't. So yes, every month we're supposed to go over all 38. So you guys are aware of where each budget line is and if there's concerns and things like that. So
Do all of these roll up into one budget then?
I think ever Health and Human Services budget, yeah. I mean, and Laura can, you know, she moves stuff around wherever it can fit. She absolutely does that.
I think Lois has it right. This is something that's got to be worked on continually because this is basically a whiplash from what happened at the last budget cycle. I jumped way overboard on it, I think, to get some of this stuff done. Now we got to figure out how it really works. That's in the meantime, you guys get stuck with it. But hopefully we'll figure out something on it, you know. I mean, we want to know those answers. But what answers do we really need? All 38 of them or?
Well, like I said, some won't change.
Yeah.
There are definitely some fluid ones that are gonna go. But
I think you're right. If anything major pops up or whatever, I mean, bring it to our attention, but
Yeah.
little nitty gritty,
Right.
reason to.
I'll give you those. You know,
So I might run out of ink.
Justice Department has the same problem you do. If we have one trial.
yeah, because you can't predict some of those things. You just can't do it. All right, so the public health, ADRC, and child support monthly reports are in the packet. So something that I added to the bottom of the agenda was I, as the director, want to do just some more recognition for our staff. Just because I feel like it is important that we recognize staff. I want them to feel valued and I want them to feel important. Kind of haven't decided exactly how we are going to do that yet. I kind of have some ideas about like birthdays, like doing one celebrating everybody's birthday in May, like have like cupcakes or something, like birthday thing. But also I just feel like it's important that their anniversaries are recognized for their years of service working here. So I did ask HR to get me a list of those things, and I'm probably going to give them a card, but thank you every month. But I'm also going to acknowledge them here at the board meeting, maybe not personally, but just say who they are and how many years that they've been with us, because I do think that it's important.
A good day for each person, and this is the day to feature you. And
I also want to do like a staff spotlight type thing is what I like kind of have in the back of my mind, but then everybody's like, oh, I don't want public recognition, you know, that type of thing. But I do want to do that because I feel some departments, just because there's so many departments and then we're kind of spread right across the hallway. We have CCS and public health over here, and then everybody else is over here. So I feel like we're a little bit siloed sometimes. We do potlucks, and we the admin team hosts breakfasts and lunches and stuff like once every couple of months for everybody. We do things like that. But I was thinking like staff spotlights where I pick one person and I just kind of tell a little bit about them. Like I'll ask them ahead of time, like what they're comfortable sharing. And then, you know, we'll send it out to everybody so we can see who they are and what they do. I got mixed feelings on that though, because like I said, some people don't want any attention drawn to themselves.
Ashley, one of the things that I used to do, and staff really loved it, was we get a picture of the person, And then the supervisor, somebody would write up a little bit of a description, and have a picture in that description, and we matted it. Just a simple mat, not a glass or anything. And then all the staff could go around and sign it and write a little comment. And that ended up on everybody's wall.
That's really neat. How did you pick the person for that time? Like,
For their anniversary, we did 5, 10, 15, 20.
okay. It's a really good
We
idea.
did first year anniversaries too. And
Yeah, I'm always
people
looking.
really like that. Yeah, they really like that.
I do. Yeah, I'm definitely open to ideas just because I do want everyone to feel valued. So I'm just gonna go through my list really quick. Rich, who was here earlier, Rich Green, he has been here 7 years as of May 1st. There is a driver for senior services who has been here 9 years on May 11th. I'm hitting 11 years on the 12th. Bailey, who was also here earlier, she's get 1 year on the 20th. Senior service driver Michael, 11 years. Haley was just here, has been here 2 years on the 22nd, and Michelle Kinney on the 23rd will be here 13 years. So I do think that a lot of there's some newbies, but yeah, I just think it's important that we recognize everybody and raise card. Kind of just getting into this because I just got the list. I'm working on it.
I like Ted's idea of 1, 5, 10, five-year increments then.
Yeah, if you're just starting out, you might want to start out where people are at. And then after that, 1 year anniversary, 5, 10, 15, but whichever increment you want to do, everybody's a little bit different in that. But the personal recognition is just really important.
Otherwise, I don't have any. If you guys have any questions for me.
Anything from anybody? Even if it's not at Ashley.
Well, I have one thought back to your comment about being at the meeting post shelter. That there are changes that suggested improvements, but so many people were involved that who's taking that on? Or is it still going to continue to look for those improvements and have a new plan?
I'm continuing to talk about 3 or 4 of the people that were there that I think should be involved in this. So
Yeah.
I think that idea of a master plan list would be very helpful.
yeah.
You're good for Chris.
Yeah, I mean, the 38 bills in there, all they have to have is a listing, contact human services, contact, then be her job to go down the line and figure out who. And
I do think Kaylee took notes from that meeting,
Yeah.
and she was gonna spearhead some of those things. So yeah.
Yeah, good idea. Thanks.
But it would help the dispatch department too, I think.
Yeah.
Mhm. Yeah, and just have one, incident command leader, just because it got a little bit jumbled. We ended up sending people to 2 different places versus just automatically going to the one, just because they were just a mixed communication there, but
well, like
something to work on.
Indian had those buses, we have to know who to contact, who can approve them coming, staying there till they're released. I don't know how they left, if they just left while we hauled everybody, so we're going.
Yeah, I don't know how.
That's pretty much the idea.
It's like the ambulance, I was sitting there at home, Mary and I both were like, you got, at least 30 people in that building, you've got a fire. Let's get all 4 ambulances rolling. It took them forever to get even the first one rolling. I mean, as I said then, we spent a lot of time on useless ambulance trips that, don't turn out to be functional. This one should be one. And they came in handy doing a lot of stuff there, I guess, so. So hopefully we'll continue to work at this. Like I said, I've sat at I sat at one of these years ago, and it was the various heads, for the lack of a better word, of various agencies, departments, whatever. They sat there and they did the plan by looking through their 3-wing binder. I was never so upset in my life. What happens if the fire's in your office? I wanted to say, but I didn't think they'd get it. Well, thanks again, Ted, for your services.
Thank you.
Appreciate
I'm
it.
gonna miss you.
Thank you.
And enjoy your next stage. And on that point, we're adjourned.